How do we determine the most optimal implant size for our patients? Well, there's two main factors. One is the patient's anatomy or frame, and two is essentially what they desire and what their goals are aesthetically. So when it comes to anatomy and frame, you really have to take into consideration the width of the chest. I think that's the most important factor. If you put an implant that's too wide for the base width of the chest, you risk having symastia or uniboob, where the implants touch in the central portion. You further risk having implants that fall into the armpit and sit too far lateral when they're oversized or too large for the frame. The second component is really what the patient is looking for, and that's where communication with the patient, looking at their wish lists are important. There are certain looks that we can provide with implants, whether you use a high profile or an ultra high profile. You may have very strong upper pole fullness. Some patients may want a more subtle fullness up top and more of a natural slope or look, and for those patients we choose implant profiles that are not as projected. There's also technology that we can use that can show patients what they would look like with certain size implants. Although it's not 100% accurate, it does really give them a good idea as to how their shape will change with a 300cc implant versus a 350cc implant or a 400cc implant. And I think having that available for patients to give them an idea before they commit is also important.